House Leader of the Third Party.
Thank you, Mr. Speaker. When British Columbians seek help for a loved one experiencing a mental health crisis, they should know this help will not result in tragedy. Wellness checks are a tool to check on the physical or mental well-being of an individual who may be in distress. Typically conducted by police without the support of a mental health team, wellness checks have resulted in increased harms or even death to the individual who needed help. Police officers have expressed they are not the appropriate response for mental health crises. My question is to the Minister of Public Safety and Solicitor General. How will the government address the failures in wellness checks and this year, in 2025, transition our mental health crisis response away from police officers and towards peer-assisted care teams? Thank you.
Minister of Public Safety and Solicitor General.
Thank you, Mr. Speaker, and thank you to the member opposite for the question. There has been a considerable amount of time investing in this province in teams that combine police and mental health workers. It is a program that is ongoing and has been successful. It is a program that we're going to continue into the future. The whole crux of the issue is the ability to meet the needs of the client. This person who is calling the police for help, or someone who is calling the police on their behalf. It's not always a police response, as you correctly noted, but the combination of a police person and a mental health worker is what we're striving to achieve, and we are continuing.
Member Supplemental.
Thank you, Mr. Speaker. Understanding the complex needs of people experiencing crisis requires professional response and expertise in mental health issues. Investment in programs like CIRCLE, Crisis Response Community-Led, offer a person-first approach to those experiencing mental health crises with trained responders to de-escalate and provide safety and support. This government has delayed rapid expansion of mental health services like CIRCLE. My question through you, Mr. Speaker, to the Minister of Public Safety and Solicitor General, what are the Ministry's targets in 2025 for increasing the number of communities that have access to life-saving, non-police mental health response services? Thank you.
Minister of Health.
Thank you so much, Honourable Speaker, and thank you to the member for the question. It is so important that we continue to make investments in different ways of approaching issues that face society, Mr. Speaker, and one of those is how we can best help people who are experiencing a crisis. The member is right. It's not always appropriate to send emergency responders or police officers to a situation, and that's exactly why peer-assisted community teams, now called CIRCLE, Crisis Response Community-Led, are teams that send people out to help people facing these kinds of crises. Mr. Speaker, we're expanding and creating new CIRCLE teams. I had the opportunity just last week together with others to visit the Victoria-based CIRCLE team and to witness firsthand, literally standing in the room surrounded by support workers who received a call and were able to act quickly to respond to a person's crisis. This is a mental health worker, a peer support worker being dispatched instead of police and providing immediate crisis counseling and resources. Mr. Speaker, we have teams that are operating in the North Shore, Victoria, New West, Prince George, Comox Valley. I'm going to have more to say soon about how these teams are expanding. They are already responding to over 5,800 calls alone last year, doing incredible work, and we should all be very grateful to them.
Thank you.